Hello, and thank you for watching this educational video about the Value 1500 plan. The Value 1500 plan accesses a PPO network. Your PPO network is listed on the front of your medical ID card. Be sure to check the network status of your medical providers prior to seeking medical care. You may check network status in the following ways. Contact your medical provider and ask them whether they participate in the PPO network that you access. Visit AdvantageHealthPlan.com and choose Find a Doctor or Pharmacy from the quick links on the homepage. Scroll down to the list of provider networks and choose the corresponding network. Or call Advantage Health Plans and speak to a Kempton Care advocate. Remember, accessing a network provider doesn't always guarantee the best price. It is important to note that there are certain providers that are excluded from Advantage Health Plans regardless of their network participation. A list of these providers may be found at AdvantageHealthPlans.com. Advantage Health Plans provides alternative options to help save you money and make better healthcare purchasing decisions. In order to make the decision simple, these alternatives are covered at 100%, waiving all patient responsibility. Many medical services are available through KPP Free, such as orthopedic procedures, diagnostic imaging, general surgeries, urology, ear, nose, and throat, gynecology, oncology, inpatient cardiac testing, bariatric, digestive testing, sleep studies, and more. Using KPP Free is as easy as 1-2-FREE. Just call Advantage Health Plans to get started. Your laboratory services may be covered at 100% if you choose to use a laboratory provider that is directly contracted for enhanced benefits with Advantage Health Plans, such as LabCard, Diagnostic Labs of Oklahoma, Quest Diagnostics, Clinical Pathology Laboratories, and more. Visit AdvantageHealthPlan.com for a full list of participating laboratory providers and draw sites. You may also receive some medications at no cost to you. We will discuss this further in a moment. Kempton Direct Access Providers is an enhanced consumer-driven benefit for primary care, preventative care, and urgent care services. When an eligible employee enrolls in Kempton Direct Access Providers, the monthly fee will be paid by Advantage Health Plans in the form of a subsidy at 100% up to $70 per month. For a list of participating Kempton Direct Access providers and to learn more about direct primary care, please visit AdvantageHealthPlans.com. Be sure to check back as the provider list will soon be expanding. The individual deductible for the Value 1500 plan is $1,500. For participants enrolled in coverage other than employee only, 2 covered persons must meet the individual $1,500 deductible. The out-of-pocket maximum for an individual is $6,500, and the family out-of-pocket maximum is $13,000. The co-insurance percentage is 70%. Advantage Health Plans will pay 70% of covered charges, while you'll be responsible for the remaining 30%, up to your out-of-pocket maximum. The copay for physician's office visits, specialist office visits, and urgent care visits is $35. Just a reminder that members who are enrolled in Kempton Direct Access providers will have no copay for services that are included in the monthly fee, such as office visits. Your deductible and coinsurance will be applied for all medical services performed in an emergency room. There's an additional $200 copay for emergency room visits, but the copay will be waived if you've been in an accident, your condition is considered life-threatening, or you are admitted to the hospital. For procedures performed outside of your physician's office, a copay of $300 will apply, in addition to your deductible and coinsurance. For some surgical procedures performed in the physician's office, the office visit copay will apply. Remember, if you use KPP Free, you will incur zero out-of-pocket costs. Pre-certification of all inpatient confinements, outpatient surgeries, and sleep studies is required. Pre-certification is ultimately your responsibility, even if the medical provider often performs this task. If you're unsure if your medical service requires pre-certification, or if to find out if your provider has completed this task, please call and speak to a Kempton Care advocate. For outpatient laboratory services, Advantage Health Plans will pay 70% of covered charges, while you will be responsible for the remaining 30%, up to your out-of-pocket maximum. Your deductible is waived for outpatient laboratory services. If you choose to use one of the laboratory providers who are directly contracted with Advantage Health Plans for enhanced benefits, there will be no out-of-pocket cost. A list of these providers is available at AdvantageHealthPlans.com. After you meet your deductible, Advantage Health Plans will pay 70% of covered charges for diagnostic imaging services. You will be responsible for the remaining 30%, up to your out-of-pocket maximum. If you use KPP free, your diagnostic imaging will be covered at 100%. All charges for inpatient hospitalization are subject to your deductible and coinsurance. Your prescription benefit plan through Advantage Health Plans is administered by Southern Scripts. It is important to remember that the use of a participating in-network pharmacy is mandatory. Prescriptions filled at an out-of-network pharmacy will not be covered. Check AdvantageHealthPlans.com for a list of excluded pharmacies. For prescription medications, this plan has a $15 generic copay and a $55 name brand copay. A 102-day supply of covered maintenance medications is available at your pharmacy or by mail order. Generic maintenance medications have a copay of $30, and name brand maintenance medications have a copay of $110. Don't forget, if you choose a name brand drug when a generic drug is available, you will pay the name brand copay plus the difference in the cost between the generic and the name brand drug. There are specific, high-cost name brand prescriptions that have a lower-cost therapeutic alternative. If you choose one of these medications included on the therapeutic alternative drug list, your copay will be 50% of the cost of the drug. A drug will not be included on this list unless it has a lower-cost therapeutic alternative. This list is available at AdvantageHealthPlans.com. You may obtain some medications, including some over-the-counter medications, at no cost to you. The list of covered premier drug tier medications is available at AdvantageHealthPlans.com. Specialty medications are exceptionally expensive prescriptions used to treat complex chronic conditions like cancer, rheumatoid arthritis, and multiple sclerosis. These medications often require additional medical management and oversight. Specialty medications have a $150 copay and must be obtained through the Southern Scripts Specialty Pharmacy. For assistance with your out-of-pocket costs for some medications, please contact Advantage Health Plans and speak to a Kempton Care advocate. Be on the lookout for communications from Script to Savings. These communications may come via email, text message, or snail mail. If you receive a communication from Script to Savings, it will include information about how you can save on your prescription medication costs. This plan does not have a benefit differential when utilizing an out-of-network provider for medical services. You are free to use the provider of your choice. However, all out-of-network claims will be processed at the maximum allowable charge, which is often a percentage above the provider's current Medicare rate. If no Medicare rate is available for a particular service or provider, another reference will be used. Physicians' charges are processed at the provider's Medicare rate plus an additional 30%. Facility/hospital charges are processed at the provider's Medicare rate plus an additional 60%. Anesthesia charges are processed at the provider's Medicare rate plus an additional 150%. Outpatient laboratory charges are processed at 100% of the provider's Medicare rate. Emergency charges are processed at the provider's Medicare rate plus an additional 100%. Air ambulance charges are processed at the provider's Medicare rate plus an additional 20%. Advantage Health Plans has a partner that offers a robust patient advocacy program. If you need assistance speaking with an out-of-network physician or facility about whether they will accept the plan's reimbursement, pre-service advocacy is available. A team can assist you in finding a provider that has agreed to accept the plan's allowable reimbursement. If a balanced billing situation does occur, there is a comprehensive patient advocacy process in place to assist you. Call and speak with a Kempton Care advocate to learn more or to get assistance with a balanced bill. Additional information about your benefits, including a summary of benefits and coverage and your summary plan description, are available by visiting AdvantageHealthPlans.com and logging into the member portal. If you have questions about your benefits, please call 800-324-9396 to speak with a Kempton Care advocate. They are available Monday through Friday, 8 a.m. to 5 p.m. Central Standard Time. Thank you for listening to this explanation of the Value 1500 plan, and thank you for being a participant in Advantage Health Plans.